Good morning, good afternoon, good evening, wherever you are located. Hi, I'm Rajib Bose. I'm an associate partner with IBM in the digital strategy practice. Currently, I'm in New Delhi, one of the epicenters of pandemic breakout. And there's a major crisis. There's a major humanitarian crisis, major healthcare crisis also. The government hospitals, the beds are full. Even the private sector, the private hospitals are also struggling. And what the private hospitals are doing, they're extending their services to the home care also. They're creating a virtual hospital within the home, hospital bed within the home. Now, a lot of technology innovations are happening. A lot of wearables, the mobile applications, mobile devices to trace the contact tracing applications are also coming up. Also on the caregiver side, the nurses, the training, which are also in scarcity right now, the skills of the nurses. Now, the nurse care, a lot of trainings are also coming up. There are almost like 3.5 to 4 hours kind of virtual training modules that have also come up. So during this time of crisis, during this pandemic time, a lot of innovations are also happening from various sources across the ecosystem of the healthcare services, what I see. Now, in this talk on tech disruptions in the consumer-centric healthcare, let me talk about 3 key aspects. Now, the first is exponential growth potential in the virtual health, or the most likely the telehealth segment. Second, the growing focus on the patient centricity. And third, of course, the technology, the disruptions that the technology is bringing in the whole game. For the past 10 to 15 years, virtual health has been heralded as a key disruptor for the delivery of the services. But there has been minimal uptake in the adoption, unfortunately. The COVID-19 pandemic is pushing against structural barriers that have previously slowed health system investments in this integrated virtual health applications. Now, with COVID-19 recovery being digital, digital should be at the core of the recovery process from COVID-19. Now, I also believe that it has to be very human-centric also. It has to be very patient-centric when the healthcare recovery has to happen. Now, healthcare has long aspired to be patient-centric. Now, new players are vying to enter into the healthcare market. They're finding abundant opportunities to own a piece of this entire industry. Large-scale consumer-focused companies are demonstrating that they have the balance sheet muscle, they have the financial muscle to buy into the healthcare in a big way. Anything from a payer to a pharmacy benefit manager to a hospital. Now, rumors are quite rampant that leading retailers and retailers with the scale to unleash the operational efficiency and pricing optimizations, the reach for customer intimacy and the technological savviness to integrate the experiences across the channels, they will soon join the party, maybe after the lockdowns or after the global over. They are very likely to change the industry we are familiar with for the last several years. Now, an overriding goal for healthcare is to control costs and to improve the quality of care. One way to achieve this is to keep the patients out of the doctor's office and away, rather far away from the hospitals. It's more convenient, accessible, and less expensive. A growing focus on preventive care, bringing the medical services to more convenient locations for individuals and for greater awareness to the wellness supported by the many personal ownership is reshaping the industry. For instance, as I mentioned in Delhi, what I see, a lot of hospitals, they're extending the services to the home, in-home assistance. That in-home assistance is gaining momentum. A lot of nurses and the home care aides, along with the voice assistants, the bots, those are also gaining momentum. Now, the retail clinics. Now, for instance, when the doctor's office are booked for the next several weeks, or in India, in some cases, for some good doctors for several months. Or when you're traveling, someone is traveling in business to other city, patients turn to the retail clinics to cure minor ailments. The digital doctors, most like this Practos and a lot of marketplaces for the doctors and the care providers, they're also gaining momentum. Personal wellness tools, a lot of wearables, the mobile apps, mobile devices, they're also gaining momentum during this time. The online retail, very much there. Now, the shopping for the drugs online or on mobile devices, they improve the customer experiences. The home delivery from everything, from the over-the-counter medicines to the pharmacist-approved prescription drugs, to vitamins, to supplements, to even some of these nutrition products that can promote the self-care, they're also increasingly gaining momentum. This all drive the customer centricity, the customer experience in the healthcare segment. Now, telehealth has helped expand access to care at a time when pandemic has severely restricted the patient's ability to see the doctors face to face. Now, actions taken by the healthcare leaders today will determine if the full potential of telehealth is realized after the crisis is passed. Now, COVID-19 has caused massive acceleration in the use of telehealth. Now, I see in Delhi definitely, where telehealth was almost virtually not present, they have also significantly increased. Now, I got some data from the US markets. Now, prior to the pandemic in 2019, telehealth was almost like 11% of the US consumers were using telehealth. And today, as on date, it's almost like 46 to 50%. Huge jump, right? And also what you see that the providers, they have also rapidly scaled their offerings. And they are also getting almost like 50 to 200 times the number of patients via telehealth than earlier they used to get, right? Almost huge, 50 to 200 times. You see the scale. Now, most interesting, the regulators also seem to be quite lenient. They are also approving additional services in the US market. I think the last 2-3 months, they have approved more than 80 services, new services that can be delivered over telehealth. Now, with this increasing momentum of the virtual healthcare and the telehealth, we believe that there's almost like $250 billion opportunity in this space. And also, out of the entire Medicare services, the Medicare, Medicaid, and the commercial services, we believe 20 to 25% of the services can be virtualized right away in the next 3 to 6 months. This is a huge opportunity. Now, this shift is not inevitable though. Now, it will require new ways of working for a broad set of providers. Step changes are requirement in the improvement in the information exchange and broadening access and the integration of technology. The potential impact is improved convenience and access to care, better patient outcomes, and more efficient healthcare system. Now, healthcare players, they may consider moves now that support such a shift and improve the future position of the entire industry. Now, many of these dynamics are likely to be in place for the next 12 to 18 months, or at least till the time we have some solution, vaccine or whatever for this pandemic. Now, during this point of time, the consumer's preferences for care access will continue to evolve. Virtual health, telehealth definitely is a big potential to scale up at this moment. Now, when we talk about the patient centricity, when you talk about this healthcare virtualization, the virtual healthcare, this telehealth and all this thing, it all depends on the adoption of the exponential technologies. And while talking about the technologies, 3 things I want to highlight. 1, the cloud, the hybrid cloud. I'll get into the details. 2nd, the patient data confidentiality, the privacy, and also the cybersecurity aspect. And 3rd is all about AI, the artificial intelligence. The changing winds of cloud, the data and artificial intelligence, they have blown healthcare into uncharted territory, new area altogether. Now, IBM, we have done studies through our IBV reports. We have talked to a lot of CXOs across the globe. We see that the healthcare has embraced, they've already adopted the hybrid cloud operating models. Driven by the increased IT demands and the need for improved security, the hospitals, they have adopted the hybrid mix of public and private cloud services. The healthcare organizations, they use cloud-native vendors for an increasing number of client-facing applications. While back-office technologies, which are less sensitive to the latency issues, they may not be very immediately required. They are most often hosted in the public cloud rather than the on-premises. But more confidential client data, because patient data, they are kept on-premises or maybe on the private clouds. Now, also the adoption to the cloud and embracing the multiple stakeholders into the cloud ecosystem, that will also bring in a lot of innovations, not just from 1 or 2 parties, but from across the stakeholders. It gives a platform ecosystem and definitely drives or rather triggers a lot of innovation all across. Data security, as I mentioned, now we believe that almost like 80 to 90% of the healthcare providers, they believe they have a robust system. But in reality, it's not. We have seen a number of cases where cyber criminals, they have actually gotten into the data. A lot of ransomware attacks are also happening. So cybersecurity remains one of the topmost priorities of the CIOs in the healthcare segment. Now, data management is also another aspect. Now, today in the healthcare system, the data is all very discrete. We need to have the data lakes or a lot of data management. We talk about the artificial intelligence, the machine learning. So we need to, this entire the data management is also quite critical, integrating the various sources of data to get the benefit and provide to convey the benefit to the patient ultimately. Now, thus cloud and the AI technology, the usage benefits, they benefit not just the patients, but also the providers as well. Now, the window to act is now, right now. The pandemic has blatantly exposed the fragile healthcare system that we have all across the globe. The current crisis, they have demonstrated the relevance of telehealth and created an opportunity to modernize the healthcare delivery system. I mentioned the virtual healthcare, the telehealthcare, there's almost like $250 billion opportunity. I also mentioned there's a potential to virtualize almost 20 to 25% of the healthcare system right now. The seeds for success has to be sown right now in the next few months during the crisis only. The healthcare systems that come out ahead of this are those who act decisively, who focus on the patient experience, on the patient centricity, and who adopt exponential technologies of cloud, AI, and cybersecurity. Thank you.